Greetings from Advanced Fertility. Today we are going to talk about difficult embryo transfers. As you know, embryo transfer is very critical to the success of IVF. And it is only after doing a good embryo transfer can we be sure that our results will reach the best possible outcome. Now, what is an embryo transfer? In an embryo transfer, we are trying to deposit the embryos inside the uterine cavity at the best possible place. Now, this place is called the maximum implantation potential, and this varies from every uterus. So, when can we face problem? When it is difficult to go through the cervix, when we require a firmer catheter, patient is uncomfortable, you are using a lot of instruments, and it is time consuming. There have been studies that have clearly shown that the more difficult the embryo transfer, the less will be your result. So as a clinician, you have to figure out whether you are anticipating a difficult embryo transfer or not. So you can get that from the history, a difficult IUI, a difficult previous embryo transfer, surgeries, patient is anxious, and non-consummation. That means difficulty in able to consummate the marriage. So when this history is there, then you also have to examine your patient. In this, you have to see whether she is obese, whether there is a scar, whether the cervix is pulled up, or whether the uterus size direction is upwards or backwards. When you are preparing your patient for embryo transfer, ultrasound visualization is very critical. Make the patient comfortable. Bladder should be full, not empty, not bursting, and the ultrasound and light settings should be optimal. If there is surrounding light, too much of light, then your visualization on the screen will not be good. In your instrument section, have all the instruments needed to clean the mucus, clean the cervix, and minor instruments to be able to give support to the cervix for traction if needed. Now, there are different ways of doing an embryo transfer. It could either be a direct transfer where your embryologist is loading and giving you the embryos and you are transferring directly, or you are first passing the outer and then you are loading the inner, or you are first passing the outer, waiting, then you are loading and doing a direct transfer. So we usually do the afterload technique in which we first pass the outer, and then once we are sure we have just touched the internal os and maybe not beyond, but at a reasonable space of internal os, then we pass the inner. So from the time our embryologist loads the catheter and gives it to me and I put it in the uterus, it's less than a minute. So what are the stages of problem during the embryo transfer? One is problem in visualization, one is problem in entering, and one is problem while negotiating. Now, these are the three different problems that we face, and in my next video, I shall be discussing about each of them in this series of difficult embryo transfer. Looking forward to seeing you soon. Goodbye.